on birthing positions in laboring mothers. So, for centuries, the lithotomy position has been a standard for mothers in active labor. The recent research tests the theory. The lithotomy position is defined as lying on your back with your legs flexed 90 degrees at your hips. Your knees will be bent at 70 to 90 degrees and padded footrests attached to the table will support your legs. Studies have shown that switching positions during birth, such as sideline, squatting, kneeling, or standing, proves most beneficial in providing comfort for the mother and baby. The use of a variety of different birthing positions may affect the maternal outcome and frequency of interventions in active laboring mothers during the birthing process compared to the standard lithotomy position. And so from that, we just want to continue going into more detail about why certain positions will make the birthing process easier.
Okay, as stated, our PICOT question is in active laboring mothers, do different birthing positions affect the frequency of birthing interventions and maternal outcomes compared to the standard lithotomy position? As Tyra already mentioned, the standard lithotomy position is when your legs are up at a 90-degree angle at your hips. The lithotomy position is the most common position used among active laboring and birthing mothers. The lithotomy position increases the changes of an active laboring and birthing mother to have an episiotomy. Sorry, chances, not changes. The benefits of the lithotomy position are not entirely known. Mothers are not often given the choice to choose what position is comfortable for them. Rather, they are more so expected to labor and push in the standard lithotomy position because it is more convenient for the provider to have access to mom and baby.
Okay, so there are many search methods that we use to conduct this. Some included systematic reviews, qualitative studies, and quantitative studies in order to examine the relationship between birthing positions and active laboring mothers, the frequency of interventions, and the maternal outcomes, because each position can be beneficial in its own way. So, one study used a randomized controlled trial method to split laboring mothers into two groups, each group encouraged to give birth in a different position. That way, we were able to read which position worked better depending on the circumstances. A qualitative study conducted used in depth interviews to examine mothers' views on the birthing experience. The mother's views can be just as important as whatever position is being used. That way, we know if the mom is comfortable and if it was less pain for her. Another study focused on group studies and semi-structured interviews to gain insight on the use of the supine birthing position by postnatal mothers and nurse midwives. And then lastly, a controlled trial randomly assigned laboring mothers to an upright or non-upright position to look for differences in the number of interventions and maternal preference. And in one of the cases, some of the circumstances were different for if the mother was using an epidural or not. That can affect the way the birth can happen. Um, the keywords that we used in research included lithotomy and birthing positions, and that's how we came up with some of our research methods.
Okay, so for our review of literature, like we already discussed, most women are encouraged to use the standing birthing position of the lithotomy position, and we have a picture of that below. but research suggests that women have the best outcome when they find a position using their own autonomy that is most useful to them. Some research even suggests the use of gravity to be the most effective. So we found that encouragement from healthcare professionals to find the best birthing position was described as a part of having control over labor. Women in an upright position for laboring and delivery were also less likely to undergo interventions, such as the use of forceps, a vacuum, or the need for an episiotomy. An upright positioning helps the uterus to contract more strongly and efficiently, and the baby can get into a better position and thus can pass through the pelvis faster. It is also found that upright and lateral positions enable flexibility of the pelvis and facilitates the extension of the outlet. Lastly, laboring women should be encouraged to choose a birth position that she finds comfortable. Researchers who aim to compare different positions should consider study designs which enables women to choose birthing positions.
For nursing implications and putting our PCOT into like nurse practice, you truly have to look at all of the evidence in birthing positions because it's different and it may affect different birthing outcomes. Research suggests a squatting position can be most useful because it follows the body's natural gravity. The downfall of squatting is it can be tiring, but forceful pushing in the lithotomy position can be just as exhausting. The downfall of research suggests that women should use what position feels most comfortable to them. Each mother has their own birthing experience, and research encourages women to choose different positions throughout the birth of the baby to provide comfort, feel in control, reduce pain, and allow the baby to come out in a comfortable way. Nurses should make sure to demonstrate and give options on different positions that could be most useful for laboring mothers. These findings that with all of our articles suggest that there needs to be further research done. The research that was done was very localized to the area, and there's not a lot out there, so more research could help better determine what is the best position. But at the moment, having the mother decide is useful. Some studies suggest that more research could help in identifying what positions work best for different circumstances. And even like if some mothers choose that they don't want a cesarean over a natural birth, what positions could help in the aid of that as well.
So, all in all, historically, women used the natural laws of gravity and selective positioning without the medical model of normal birthing. And research also shows that most women give birth in the supine position, as we discussed before. But it is proven that once we stated that birthing, switching up positions or giving birth sitting up will be defining gravity, and it should also be counseled to expecting mothers that self positioning is preferred, and mothers must be willing to delay forced pushing until the body can create that natural urge for it, and recognition that the length of birthing is good and can be prolonged with no issues.
I think that our PICOT question is extremely important for birthing and laboring moms. Being a mother myself, I've had 2 kids in the standard lithotomy position with an epidural both times, which leaves you unable to be able to move into different positions. And I tore both times with both of my kids. And I think that had I been able to get up and move around as I pleased, that the tearing wouldn't have been as bad, I guess you could say. I think mothers should be able to choose the comfort for them, how they want to labor and birth their child.
With the evidence presented from our project, this is our stance on our PCOT question, that we agree that all mothers should have the choice in what birthing positions are best for them and whether or not they want to switch throughout their birthing journey or not. So